What's up? My name is Lopez. I'm going to be demonstrating how to administer medication through an IV piggyback. First thing I'm going to do is I want to wash my hands, check the doctor's orders, check the MAR chart, identify the patient with 2 forms of ID, come in, introduce myself to the patient, introduce the procedure, and provide privacy. Now I'm going to identify the patient with 2 forms of ID. Hello, Mrs. Johnson. How you doing? Now I'm going to raise the bed before I do anything. Raise the bed up to working height. Alright, I'm going to be putting on gloves. And I'm going to assess the IV site, make sure there's no signs of phlebitis, infiltration, infection, swelling, anything. Everything looks good. And now I'm going to get the IV piggyback medication ready. I'm going to check the medication against the MAR chart, make sure this is the right medication, do my 6 rights of medication, right route, right dose, right patient, right time, right documentation, and I think I said right patient already, whatever. So then I'm going to put a label on the medication, and I'm going to double check, make sure that it's compatible with the IV fluid that I will be infusing it with. I'm going to get the tubing ready, make sure that it's the correct tubing. Okay. So what I'm going to do is I'm going to make sure that the medication is clamped, totally sealed off. And I'm going to spike the medication. Just going to hang it up like that, like so. And I'm gonna clamp the IV fluid just for a quick second. I'm going to take an alcohol pad. Gonna sterilize the port. 15 seconds. Use a different alcohol pad. I'm going to sterilize the port that I'll be administering it to. 15 seconds, boom. Now I'm just going to prime the chamber. And I'm going to just get all the air out of the line, but I'm going to be very careful with this because I don't want to waste any medication. So I'm going to open it up very gently. Alright, so now I'm just going to ID the patient one last time before I actually administer the medication. Hi, Mrs. Johnson, how you doing? Now that I have no air in the line whatsoever, I'm going to attach it. Now the ports have been cleaned. There we go. Now I'm going to use the little hanger, lower the primary IV fluid so I got the medication on. Right, and now I'm going to open the medication up completely. And I'm going to regulate the primary IV fluid. I calculated the drops, and the doctor's order is 32 drops per minute of the medication. So I unclamp it. Now I'm going to six, 7, 8. we go. 32 drops per minute. And I'm just going to let that run, let the medication infuse. I'm going to label the IV fluid, label the tubing. Now I'm going to raise the bed up. Put the bed back down to normal. I think the battery's dying on this thing. I'm going to leave the medication running. I'm going to take my gloves off, and then I'll record everything on the O chart, wash my hands, and then just for video purposes, just for time, I'm just going to say I would leave the room, record everything on the MER chart, INO chart, and I'll come back in an hour after the medication has properly infused, and then I'm going to remove the medication and put the primary IV fluid back up and re-regulate the drip rate factor back to what it was, using the primary roller. And then I would just document everything again, and that's it.